Namo Narayana. Welcome in tutorial session of Vrikshasana. In this video I am telling you how to do the Vrikshasana, what is the procedure and what is the benefit, as well as what precaution you have to take. Then let us start how to do the Vrikshasana. What is the procedure, how to achieve the final posture of the Vrikshasana. Then I have two models here which demonstrate the posture of the Vrikshasana. Then so first of all you have to stand in a Samastiti. Samastiti means you have to stand in a standing posture with being aware about your breath and posture, body. Okay, then you have to start the Vrikshasana. First of all, either you can start from the left leg. Then in today I am demonstrating you to start from the right leg. Then first of all start kept your right leg and start to bring up your right leg, and try to keep your feet in thigh muscles. Okay, then watch here. This is the posture. First of all you have to bring your leg in your nearby your perineum region. Perineum region is that region which lies between your genitals and anus, the blank space between the middle point between your genitals and anus is called perineum region. Then your heel should be in perineum region. Heel should try to touch in perineum. Then after making the balance, you have to bring your hand in your chest. Okay, this some sources, this posture is called Ek Paad Pranam Asana. After doing Ek Paad Pranam Asana, what you have to do, with inhale you have to raise your hand up and try to bring your hand straight. Then what point you have to remember, first of all your heel should be touch your perineum, hand should be touch with your ear, and fingers is pointed, and you have to stretch your waist maximum, and gaze should be in front. Always try to watch in a front, just parallel to your eye. Try to locate one point and try to watch that, and try to make the balance as much as possible. Then relax with same position. First of all bring down your hands, then after that bring down your leg. This posture can be done from the opposite leg also. Then this is the procedure, exact procedure of doing the Vrikshasana. Then what now I am talking about the precaution. What precaution we have to take for doing the Vrikshasana. First precaution, raise your leg, this leg. Because these two are the practitioners, all practitioners of Vrikshasana, they have a perfection to achieve, they have the ability to achieve the final posture. But if you are the novice, unable to achieve the final posture, suppose that your pelvic joint, hip joint is not free, then what you have to do, only raise your leg and try to keep it in calf muscle. You have to keep your leg in a calf muscle, and you have to do the Vrikshasana. Okay, in this posture initially, then after practice. But here you have to remember one point which is very important to notice down. Never keep your feet in your knee. There is a very blunder mistake. If you keep your feet in your knee, then what's happen here, opposite leg create the negative pressure in a knee, and near future you can suffer from any knee problem. Okay, then what you have to remember, never keep your feet on a knee. If you are a beginner, then keep your leg in a calf muscle. Then after practicing, down, relax. After practicing, what you have to do, rise, try to practice and rise when your hip joint is free and pelvic joint is free. Then you can raise your leg and try to from calf to try to bring this leg in a thigh muscles. Bring your leg in a thigh muscles and try to practice regularly and try to keep your heel, try to as much as possible up near the perineum region and near the perineum region, and take the body straight, gaze should be in front and try to watch in a front, and hand should touch the ear and it is pointed towards the sky. Okay, this is the final posture. You have, with practicing, you have to try to achieve this posture. Now relax. Now the few points again in precaution you have to remember. Relax. When you are doing the Vrikshasana, then if you are suffering from the migraine, and if you are suffering from the insomnia, and if you are suffering from the high BP, then if you are suffering from insomnia and migraine, then never do the Vrikshasana. And if you are suffering from the high BP and if your BP is not controlled, then try to avoid to do the Vrikshasana. But your BP is you are suffering from the high BP, but it is stable, control, then what you have to do? You have to do only the Ek Path Pranamasana. Again, these two demonstrating the Ek Path Pranamasana. Again, with inhale, rise up your leg and bring both hands in your chest. Normal breathing, and we have to aware about your posture. Breathing is normal. Okay, if you are the initial practitioner, then in whole posture breathing is normal, and time duration depend upon your practice. Start to do from the few seconds to increase with practice, and you can do it in gradually. You have to increase the time limit from few seconds to few minutes, and you can with practice you can do it in hours also. Okay, but depend upon your need and your practice. Then you have to start only from the few seconds. If you are a beginner and just start to do the Vrikshasana, then start from the few seconds, and gradually with practice you have to increase your time limit from few seconds to gradually minute. Then with practice you can do it in hours also. Okay. Now the next precaution you have to remember, if you are suffering from any type of knee problem, if you have any type of knee problem, then you have to avoid to do this asana, Vrikshasana. Don't do the Vrikshasana. Also if you are suffering from any type of problem in which your leg is weak, or you have any type of operations in your leg, any wound or pain in your leg, then avoid to do this asana. Okay, and if you are very old, unable to do, weak, then also avoid to do the Vrikshasana. And if you are in such condition, you are old, weak, and just start the asana, then better to start from the subtle yoga, and gradually add the other asana gradually, and also add after some times when your body is allowed this type of balancing asana. Okay, now the next important thing and very important thing is what is the benefit to do the Vrikshasana. Okay, then now I am going to talk about the benefit. Vrikshasana, according to name, Vrikshasana is made by the two words. One is Vriksha, second is asana. Then what is the name of what is the meaning of Vriksha? Vriksha means it is a Sanskrit word. It is Vriksha means the tree. Okay, and the next thing is asana. Asana means posture. Then that posture which look like the tree is called the Vrikshasana. Benefit to do the Vrikshasana. The first benefit is it is a balancing posture, and whole the balance of our body is controlled by the hypothalamus part of the brain, which lie behind the brain. Okay, then when we are doing when we do the Vrikshasana, then what's happened, the hypothalamus part of the brain is activated, then it enhances the balancing of whole the body, and if the body is balanced, then mind is also balanced. Okay, now the next important benefit of Vrikshasana is it enhances our nervous system. It is very important posture to enhance the nervous system. Also it is very important to enhance our balancing of the body, and also it helps to control the minds, means it helps to concentrate our minds. Okay, and also feel when we do the Vrikshasana, then feel the relax, because it concentrate our minds. The next benefit is it stretches the calf muscles, thigh muscles, and muscles of the spine and muscles of the hand also, because it is when we do the Vrikshasana, then we stretch the whole body upward, then it stretches the all muscles of the legs, spines, as well as the hands. Then it is very beneficial of approx the all the major muscles of our body. Okay, now the next benefit, which is also very important, Vrikshasana is also helpful to patients who suffering from the sciatica pain. Then some form of sciatica pain, Vrikshasana is very important. Okay, this is all about the benefit of the Vrikshasana. Okay, now friends, if you feel this video is useful for you, then please like this video and subscribe also my channel, and share video. And if you want to give the suggestion of if you have any question, then please comment. Okay, thank you for watching. Namo Narayana.